So I saw you're posting on LinkedIn again, and you posted a picture of yourself delivering groceries. Are you doing Uber again?
Kind of.
All right, but in all honesty, you're doing some pretty cool stuff. You've been, for the last 2 years, growing FareRX. Tell me a little bit more about what you're working on.
Yeah, but to go back to your analogy really quick, the career path has been from trash man to grocery delivery man.
You are a high
moving
achiever.
up the ranks.
You are
right
definitely
now.
moving up. Yes.
Yeah. But,
Chief trash collector.
So, but right now we're building FareRX, which is a food as medicine company focused on delivering nutrition programs, fresh groceries, prepared meals, dietitian training and counseling to people that are struggling with chronic disease primarily. We address a bunch of other challenges that are called other social determinants of health, things like transportation, food insecurity and access, anything that is making it harder for people to stay healthy that fits outside of your doctor's office. Because a lot of people think about healthcare as your doctor's office and the prescriptions that you take, but it's all of the other social factors that ultimately determine the outcomes and how people, whether or not people are healthy. And unfortunately in the US right now, I mean, we are fortunate in a lot of ways. And one of those ways is that we are healthy. We are not diabetic. We're not pre-diabetic.
We are, or our country.
You and I.
Oh, okay.
Because that's no longer the majority of this country. 54% of American adults are now pre-diabetic or diabetic. So the majority of Americans are now pre-diabetic or diabetic. That's a problem. That's a massive problem. And not only that, but the issues around health in the U.S. are economic issues as well.
Right.
So healthcare spending as an industry is over $4 trillion annually in the United States. And according to the NIH, the National Institute of Health, about 85 to 90% of that spending is on chronic conditions. The majority of those chronic conditions, if you look to all of the authorities when it comes to health and nutrition, diet, exercise, you name it, the number one intervention before any pharmaceutical interventions, before exercise even, the number one thing that you can do to slow the progression or prevent or reverse the course of a chronic disease is food. It's diet.
All right. So pump the brakes there, because that's huge. And what you're trying to tackle is no small issue. It's not selling t-shirts like we did for the first 12 years of our careers.
Yep.
It's not building real estate, which we do as well right now. And I think this is where I want to give you credit, because you're building a business in a industry which is highly regulated and difficult to build in. And you're also addressing an issue that is like equivalent to sending rockets to the moon. Like, this is Elon level shit. Like it is. Like, I mean, with what I do, like I'm not actually doing the impact that like we've done with United by Blue before, or with what you're doing now. Like you're tackling a big issue. Now, granted, it's a business, and you're also unlocking a major nut here that could make a lot of money as well. Because like you said, $4 trillion is, what is it, the biggest industry?
Yeah, the fastest growing.
Fastest growing.
Yeah.
But it's also the biggest, like, eye-opening, some of those stats. Like pre-diabetic, half the country, are you serious? Like, that's insane. Diabetes is a big deal.
Yeah, and in most cases, people that are diabetic, I mean, it means you are managing a condition for typically the rest of your life. If you're pre-diabetic, you're most likely going to become diabetic if you don't make any changes. And
you don't want diabetes.
You do not
want
to
be clear.
Correct. You do not want to become
diabetic. It's not like
diabetic.
getting a cold.
No, exactly. And you are typically then medicated. You jump on this pharmaceutical treadmill for the rest of your life, typically. So, and that's the issue as well, is that these conditions And these chronic conditions, which mean that they last forever, are happening earlier and earlier and earlier in Americans. So right now, things like diabetes, obesity, those weren't really a thing with kids 2 generations ago. And you would have, when our parents were growing up, a pediatrician wouldn't see maybe any diabetic kids in their entire career in their practice. Now it's nearly 30% of kids that are pre-diabetic or diabetic. And that means that those kids, if no lifestyle interventions are made early on, they are on a path to type 2 diabetes, probably by the time they're in high school, if not earlier, and a lifetime of medication and management of diabetes without ever solving diabetes.
I mean, that's scary because we both have 7 kids combined. And, I've seen the challenge with raising kids right now with how much processed food they're just constantly wanting and craving. And we've tried to regulate that. And I think we've done a decent job with that. That is back to the socioeconomic paradox as well, right? Where we have the luxury of being able to do that by buying higher quality stuff and everything like that. But it's even hard for us.
It's hard to know who to trust and what to buy in a lot of cases. You go to a grocery store and the vast majority, I don't care if you're going to a Trader Joe's or a Whole Foods, there is still processed foods
right
in those stores.
The health food stores are not immune to this.
No. And your average grocery store that the average American has access to, if they even have access to a grocery store, because, in urban centers like Philadelphia, where we're from, where we're based at FareRX, we live, there's significant pockets of food deserts, which basically means that the people that live there don't have access to a grocery store with public transportation to it. If they don't have a car, they can't get to it. So there are...
Is it dollar stores that they're shopping? Did I hear that?
Yeah, they're dollar stores, at convenience stores, corner stores is one of the primary sources of groceries in Philadelphia.
That's not even groceries.
They're not groceries. And they...
Chips? What is the diet? What is the American diet?
It's processed food.
Got it.
About 57% of U.S. calories consumed are coming from ultra-processed foods. So that is, again, it's hard to even call them food because they're products that are made in a factory. That's not food. What we're doing at FareRX is delivering real food, fruits, vegetables, natural proteins, dairy, things that are coming from we're delivering food that was eaten 100 years ago before this kind of industrial food movement came. And if you go back to that time period and you look at how many people in the 1920s were overweight, were diabetic, it didn't exist. People literally were put in the circus when they were obese because it was that rare. You were a freak show if you were obese back then. And now you walk around, any part, name your town, America, and it's common. We're a joke in other countries. People can pick out Americans.
They can.
No matter where they're at, because we have become a society that is getting sicker, getting fatter, getting less fertile, and dying sooner.
I don't want to necessarily dive into this too much, but isn't it weird then culturally that we are being encouraged at a young age this idea of, and again, I don't want this to be taken the wrong way, but body positivity and big is beautiful, and having models and everything like that, on Target's website and all these other places being probably actually medically obese, right?
Correct.
And we're
clinically obese,
and we're celebrating that as body positivity versus actually saying, well, isn't there an issue here? Mm-hmm. And it's yes, it's not to make fun of people, because we would never point.
That's not the solution.
We never put them in the circus anymore.
Correct.
I've long had I yo-yo my body weight. I've been I'm probably overweight. I'm not obese, but I'm probably overweight, which is probably like a lot of people like me normally, like normal people that are like, they're not unhealthy, but they're overweight. And then I flirt with obesity and then go down and then I get really good shape. But like, so I get the challenge, and I get the challenge for me with like a very like educated mindset around food. But like a lot of people don't even know how to eat healthy. And that's what you're trying to solve. Because maybe explain that a little bit more, because I sometimes even struggle to understand. You're delivering groceries, which anybody could get if they went to a grocery store. Sometimes they don't have access, but if they went. But like how does that change behavior?
That's a great question. And I think that the challenge is choice in a lot of scenarios. So what you have in your refrigerator, in your pantry, is what you're going to eat. When you go to the grocery store yourself or wherever you're shopping for food, you have all the choice and you're making the decisions. And people that are struggling with chronic conditions have typically made decisions that have led to their status of health in that moment. And what we're doing at FareRX is giving them a new option through insurance plans. So we're not direct to consumer. We are 100% B2B, directly through an insurance plan.
That's the key, right?
That is, I think that is right now, there's a lot of angles that we have to come at this issue from. But for FareRX and where we fit, and my belief is that one of the best ways to get people on the right track is to start at the root cause. The root cause is food. We know that there are millions, and in a lot of cases, billions of dollars that are being spread out across the United States to help people manage their chronic conditions. The perspective that I have and the perspective of FareRX is that as opposed to giving them a medication and trying to manage their condition, why don't we try to encourage lifestyle change by simply bringing them fresh, whole foods that, if cooked, can be super tasty, really simple to prepare, and get them on track to help them make a lifestyle change that's long-term, that's lasting, but you need to give them the tools. If you gave them and we don't allow members to pick what's in their bag. That's why we have a registered dietitian. If I let you pick what goes in the bag, then you're going to pick things that may not be good for you, because the type of food, even when you're eating whole foods, there are specific items that could be negative to whatever condition you have. So in a situation with somebody that has diabetes and is trying to manage their blood sugar, we can't be sending them grapes in a lot of scenarios. Natural, fresh, fruit, high in sugar.
High in sugar, yeah.
I'm not sending grapes to somebody that has prediabetes or diabetes. And then other folks that are dealing with things like hypertension and dealing with heart disease. All of these we can manage when it comes to what we're eating, but we have to send them the right fresh whole foods and give them the right recipes. So somebody that's hypertensive is not, loading their food with sodium or eating a lot of soup that are typically high in sodium content, which may be more acceptable for somebody with a different condition, but we have to focus that in. And that's why what we do is our team builds we call it a menu, but it's basically a grocery list that gets put together with all the nutrition information, with the recipes that get delivered directly to the member's doorstep. And we're giving them, in that situation, the tools to make the healthier choice and guiding them to health, as opposed to saying, here's take these pills. This is the solution.
Food is the medicine in this case, right?
Food is the medicine. That's that was the inspiration for the name too. The idea of you've had an Italian fare. Well, fare is a type of food, and in this case, the food is the RX, is the medicine, is the prescription.
Got it.
But I really believe that there is an opportunity to make an impact with FareRX that is a human impact, which has been what's motivated me for this. And I think that is something that I've always wrestled with in business, because I am an entrepreneur at heart. I'm a proud capitalist.
You want to make money.
I want to make money.
Yeah.
Because it's a challenge.
Right.
And it affords me time to spend with my 4 kids, time to spend with my wife, time to spend with my parents and friends, and do things that matter in my community. And that's what I'm passionate about as well. It's like I want time. Money buys time. And so I'm now and always will be a capitalist. And I'm not ashamed of that in any sense. Like, yes, I want to make as much money as possible. But as I make more money, I want whatever I'm doing to have an impact tied to it that is bigger than just money. Because there's, I mean, you and I have done it. There's a million ways to make money. Making money.
There's easier ways too.
There's easier ways. We've learned that as well.
Yeah.
But I think that, while you're making money, finding a way to have an impact has been like a next level of fulfillment and another level of challenge that I've enjoyed. And that's what I love about FareRX, is that, I mean, it's an industry that I had zero experience in. I'm the total outsider. I mean,
but that's what makes it so good. I feel like your ability to come in and actually make an impact is actually why this has the potential to make you not only $100 million, like this is a huge play financially, but it's also a massive play from an impact standpoint, because it is the old guard and the traditional systems that have put us in this position and created such an unhealthy country and unhealthy culture around obesity and food and everything like that. And so if you were born and bred in the healthcare industry, you'd be pumping that same shit. Like,
that's a great point. Yeah.
Like you had to come in from the outside, just like when we did United by Blue and we came in and we're like, let's remove a pound of trash for every product sold from the oceans. Like it actually was like, maybe that hearing that in 2024 sounds like it's been around, but like that was novel when we were doing that, and it was new, and nobody else was looking at business that way.
And honestly, I don't think that we would be sitting here right now if it wasn't for that initial mission. And that was your idea. That concept was yours, of building a clothing brand. I mean, it was a t-shirt brand at the time with United by Blue that was going to remove a pound of trash from the oceans and waterways. I would not be sitting here with you, and we would have worked together for a couple of years, but that the mission was the reason that I was so all in on United by Blue. I grew up wearing T-shirts and hoodies, and fortunately I get to do the same today. But
we both regressed.
Yeah, exactly.
Since United by Blue's done.
Exactly. But I think that it was in that moment that when you asked me to join United by Blue and build this thing with you and help you build the impact, that's what I fell in love with. I felt that I liked the product that we made. I'm still wearing, this is a United by Blue flannel, actually. Yeah, that's impressive. So there's still a few pieces in the closet. Like we made great product.
We did.
And that's what allowed the brand to
and
eventually
we sold a
grow.
lot
And we sold, millions of products. So we made great product. But what kept me around and kept me motivated to make more product and sell more product and open more retail stores and build a new e-commerce site and everything that we did was the fact that we were having an insane impact. Like, I still remember the very first United by Blue cleanup that we started. We had 4 T-shirts. We're selling them to anybody that would listen to us at the time. And then we organized this first cleanup. I spent way too much time organizing one cleanup. It was probably a half of a semester. I was still a sophomore at Temple when we started organizing that. And we had that cleanup. Maybe 30 people show up, and we're picking up trash from the Schuylkill River. And I remember removing over 100 pounds of trash and being like, wow. I think we talked after that cleanup and like, what if we could remove 100,000 pounds of trash one day? What if we could remove 1 million pounds of trash one day?
Right.
And to me, that was exciting. It's like the ocean pollution problem was massive. in a totally different way than what I'm working towards now with FareRX, but it was a massive problem. 14
billion. I mean, that sounds low now thinking about it, but 14 billion pounds of trash dumped into the ocean every year
on an annual basis.
On an annual basis,
and and those are again old stats. It's the number's probably higher now.
I feel like it's increased, even though I feel like people's awareness for these things have increased. It's not slowed the trash problem.
Yeah, so we were solving an issue, we were making an impact, and that's what was so exciting about United by Blue in the early days and even through the growth process, because that took us because of that model where every business transaction was tied to the environmental action of removing a pound of trash. We built a big company that sold millions of products, and as a result, we removed over 3.5 million now to 5 million pounds.
Well, the company's still going too. And have you actually seen
they're still doing
recently?
Cleanups? Yeah, which is amazing.
I was so stoked to see that the website or the social media for United by Blue.
Yes.
Like they're doing cleanups still.
Yeah.
The mission lives on without us,
which is incredible. I mean, it's going to be like that company is going to be 15 years old, and
that's really crazy.
And we've now been detached from it for a couple years.
Yeah.
And to see that those seeds of that first cleanup that we planted,
proud of them,
back in 2010,
I know,
are now,
and the cleanups are actually well attended.
They are, and they're still making a meaningful impact. And like that's incredible. Like we always talked about the ripples in United by Blue, and like it takes change starts small, and these things grow over time. And why does 1 pound of trash matter? Why does 10 pounds of trash matter? Well, you're building it's
the compounding effect.
It's a compounding effect, and it's also education piece. Again, there's a lot of threads that are very similar to FareRX, and why I'm in love with FareRX is because it's education, it's awareness, it's the ability to give people the tools to do something, to understand there's a problem here. First, recognize the problem, give them an opportunity to solve the problem, to make changes in their own life, because that was part of what we were doing with United by Blue. Us picking up a pound of trash was really just a Band-Aid for, that wasn't fixing the millions and billions of pounds of trash that were going to the oceans every year, but it was creating awareness for the issue and changing lifestyle, changing habits of how people thought about plastic, how people thought about trash, and moving to more sustainable long-term options as opposed to disposables, things like that. And that's what we're trying to do with FareRX as well, is like giving the member the opportunity to learn. And the reason we don't do a ton of prepared food, we do it when prepared food is needed or necessary if somebody's unable to cook or things like that. But why I really love grocery is because it's the concept of teaching a man to fish as opposed to giving a man to fish. Because if I send you prepared meals for 6 months, you may, and if you adhere to that and you eat them, you may get a lot healthier during those 6 months. But what did you learn over the course of those 6 months? If you pulled out, opened up your box, put it on the stove top, tossed it in the microwave, yes, you had a healthy meal, but is that sustainable? Did I teach you anything? And is there any long-term habitual change that comes from that? My argument is no. And whereas if I am giving you the tools and trying to pair that with the education along the way, so you're getting new recipes on a weekly basis every time we are delivering you new food, we're introducing you to new food. So, what I send you in week 1 looks a lot different than what I'm sending you in week 4 or week 12 of a FareRX grocery delivery program, because I'm building trust with that member. I'm building that they are building confidence and trust in their own ability and desire to cook these foods, because the more that they eat them, the better they feel. And becomes a self-perpetuating cycle for them. And I can leave them at the end of the program knowing that I've given them the tools and the resources to go do this on their own, and to identify, all right, I'd never seen an avocado before, let alone eaten an avocado. And now I've tried an avocado and it's kind of good. I think
that's one of the craziest parts of the impact that you're aspiring to make with this is like the people, it is hard for us to conceptualize what you just said, which is, I've never seen an avocado, but that's a real thing, right? Like the lack of access to fresh and everything like that. It's like, it's mind boggling. So tell us, or tell me how many groceries, how many boxes, like give some stats on FareRX and like what impact you've had thus far with how many people you've served and where this thing's going.
Yeah, so we're getting close to 100,000 bags of groceries that we've delivered. And that is, a big piece of what we do is the actual physical delivery. So we're not shipping these items. It's very high touch intentionally. It's very analog intentionally. And we are doing it in a way where we have a fleet of drivers that are leaving from a FareRX hub where we are hands-on packing, portioning these groceries and dropping off a member's doorstep, building that initial connection
face-to-face
and relationship face-to-face with the member, which again is a point of trust. And then it's also a point of connection that can make somebody feel better emotionally prior to them even eating any of the food that we're delivering to them. But then that's allowing them to trust in this food that maybe they've never had in their house before. These healthier options. All right, I kind of like that guy that dropped food off on the doorstep. Like I'll try this. And so we're now at the point where we're closing in on our 100,000th pound bag of groceries delivered. And
what is that in economics? Like how much revenue has FareRX taken in with that 100,000?
Yeah, well, cumulative revenue, or $4 or $5 million of revenue now. And it's been profitable, which again, something we talked about previously, going from years of building United by Blue and struggling to find ground and struggling to find footing with profitability and scale and team and raising a bunch of money. This has been it's been a different mindset and a different path. We're a product-based business because we are sending people food, but we're really a service-based business. The majority of the costs, the COGS associated with FareRX is people. It's human capital that is going into this because we are just as much a service as we are a food or a product. And I think that we've been able to rewrite the script of how we're doing business to make sure that we've built, even from the early days, a profitable model that has allowed us to continue to grow the business and continue to grow the impact.
It sounds pretty sticky too, because the personality or the personable aspect of it, hand delivering and tailoring the boxes to people's conditions. AI can't replace it. Mm-hmm. Other competitors that want to come into the space, it's difficult. Like this could be massive. Like, where do you think this goes? Like, how big does this get?
The vision that I have is that FareRX can be a key piece of solving the nutrition crisis that we have in the U.S. And what does that look like? Well, that means that we are currently pursuing growth into other markets around the country and getting in to work alongside health insurance plans and figuring out how we can benefit them, help their members, and drive healthier outcomes through food and through food deliveries. So I think that long term, this is what we are doing with Food as Medicine at FareRX has the opportunity to change the course of all of those stats that we talked to early on in the show, where we don't need to see. I do not want to see my kids or my kids' classmates and their friends struggling with diabetes in elementary school. That's crazy to me. Yeah. That's not the world that I want to leave behind. And that's why I'm so motivated to do this more than just in the pocket of Philadelphia that we're in right now, because this is not an issue that is it's not based on any specific geography. It is a national problem that I believe we have a solution to.
Well, I think there you have it. You're solving one of the biggest issues in facing humans, and I'm just a tent salesman. So I don't think we need me anymore. That's the pod.
All right, brother.